Hello, my name is Dana Thomas. I'm doing a physical and health assessment video for Maryville Health Assessment 612. Professor Swope is my instructor. Um, so we're going to go ahead and get the assessment started. For the purpose of this, we're going to assume that all the results are normal because I'm quite long-winded, so I like to discuss the abnormals, which we don't have time for. So we'll just assume everything is normal, and I'll just kind of go straight through the video so we don't go over our 30 minutes. Um, so we have patient NW here, an 18-year-old female. We're going to be assessing today. So I had her empty her bladder before she came in. We went ahead and did her height and weight, her vital signs. Her temperature is normal, 98.6. We opted to go ahead and put on the gown. We're going to improvise, and of course, we're doing this at home. So we did the Snelling, which is the distance test, and the Rosenbaum on the charts outside before we came in, which is the near vision, which is optic nerve number 2. For the purpose of this, I'm going to go ahead and say the cranial nerves as I go, which will keep me on track and kind of hopefully won't forget any and keep the flow going. So we're going to go ahead and start. So when she first came in, I just did a visual overview of her, just make sure my overall inspection of her, everything was symmetrical. Eyes sit symmetrical. Ears, don't notice any deformities in the face. No lesions, bruising, or rashes on the skin. No abnormalities or anything like that. So we did an overall inspection when she came in. We're going to start from the head. So just looking at the head, no abnormalities. I'm going to go ahead and assess the scalp and the skull. Feel that. It's normal cephalic. Don't feel any lumps, lesions, or anything like that. Hair is evenly distributed. It's not breaking or coarse or anything like that. We're going to go ahead and palpate her face, for her facial bones, for any deformities or anything like that. While I'm here, I'm going to go ahead and just lightly palpate around her sinuses for any tenderness or any signs of tenderness or anything like that as far as the sinuses. Next, looking at her, I'm going to go ahead and have her do some facial movements for me. This is going to test her cranial nerve number 7, which is the facial nerve. We're also going to be testing cranial nerve number 12, which is the hypoglossal, which whenever she sticks out her tongue. And then we're going to be testing cranial nerve number 5, which is the trigeminal, whenever we do the WIS test. So we're going to go ahead and do the assessments here. So first I want you to smile for me. Stick out your tongue. Squint your forehead. Okay, and clench your teeth. Okay, and I'm just going to feel here. Okay, open your mouth for me. Open. Close. Okay. Temporomandibular joint, I didn't feel any clicks, notice any TMJ or anything like that. And stick out your tongue. Stick out your tongue. Good. I think we forgot that one. Okay, so I didn't notice any abnormalities with that, so everything is intact there. Now we're going to go ahead and do the WIS test. So we're going to take a soft piece of cotton. I'm just going to do that. So we're going to tell me whenever you feel this. Yes, 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 yes. Okay, so now we're going to do something a little bit more dull. Okay, how many feel it? Yes, 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 yes. Okay, so that's all positive reactions to the WIS test. So next we're going to go ahead and we're going to move to the eyes, which is going to be testing optic nerve 2 as well. And we're also going to be including the optic nerves 3, 4, and 6 whenever we do the ocular movement. 3 is the ocular motor, the 4 is the trochlear, and 6 is the abducens. So whenever we do the eye movement, we'll be testing those nerves as well. Okay, so just looking at a general of her eyes, her eyelashes, there's no sparseness. Their eyes sit equally symmetrical. There's no nystagmus that I'm noticing with her looking at me. There's no styes, hordeolums, or anything like that. So we're going to go ahead and just lightly palpate over the eyes for any tenderness or anything like that. While I'm here, I'm going to go ahead and palpate the lacrimal apparatus. No increased drainage or anything like that I don't see. So we're going to go ahead and assess the eyes themselves. The sclera is white. We would look at both. The conjunctiva is pink and moist. There's no increase like drainage or anything like that. So we test them both. So since I have my pin light, we're going to go ahead and test for her constriction. So just look ahead at me. Okay. Okay, that pupil constricts. Okay, constricts with the light, so they constrict equally. Now I want you to stare at the light. Stare. Okay, so the eyes accommodate. So her pupils are equal, active. Pupils are equal, round, and react to light and accommodations, which is a normal sign. Okay, now we're going to go ahead and do the cover and uncover test. So I want you to hold your hand over your right eye, stare at the light, stare at the, focusing on the pit. Okay, uncover. Good. So when she uncovers, they both constrict equally. They focus in on the object, they can focus. Okay, let's do the left. Focus on the pit. Okay, uncover. Good. So that's a positive sign for that. Next, we're going to go ahead and assess her visual field and her ocular motor movement with her eyes. So what I'm going to do is I want you to cover your right eye. I'm going to cover mine. I want you to tell me whenever you see my hands coming in. We should both see them at the same time. So can you see that? Yeah. Okay. Yes. Yeah. Okay. Cover your left. Put that there. Okay. Yeah. 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 Okay. So I saw at the same time as her, covered my eye. We did it equally. So that is good ocular peripheral vision on her eye. So next we're going to go ahead and do the movement. So focus on the pin. Keep your head straight. Don't move your eyes. I mean, don't move your head. Move your eyes. Okay. Okay. So she has good movement of her eyes, and she's able to follow the object with no problem. So next we're going to go ahead and move to her ears. I think we got everything on the eye. We're going to go ahead and move to her ears. Ears we're going to look at, make sure they're sitting symmetrical. Feel the auricles, make sure there's no lesions, keloids, any abnormalities, any crusting outside of the ear. We would go ahead and take the otoscope and we would look into the ear, assess for any increased drainage, increased cerumen, or anything built up in the ear. The eardrum should be pearly gray. Of course, we would do that for both ears. Assess the eardrum, should be pearly gray. You could do a tug test just to see if there's any tenderness noted at her eardrums or anything like that. Any pain with that? Okay, so that's normal with the ears. The ears test the vestibular cochlear cranial nerve number 8. So that's what we're assessing for. Next, we're going to go ahead and do a whisper test. I'm going to whisper a word to her, and she should be able to repeat it from behind. Hello. Hello. Okay. So she had a normal whisper test. Again, it's cranial nerve number 8. She was able to repeat the word back to her. Okay, so next we're going to go ahead and go to the nose. First thing we want to assess with the nose is just make sure that it's midline. Don't see any abnormalities with the nose. Next, we're going to go ahead and test the patency. This is cranial nerve number 1, which is the olfactory nerve. So close out your left nostril. Take a breath in. Breathe in. Good. Do the right. Okay. And smells okay. Nope. Okay. You could test with like coffee and different scents in the office to see, make sure that the smell is intact. Next, we're going to go ahead and just have her tilt her head back. We're going to look into the nares. Turbinates are normal. She has a pink mucosa nares. It's not red. No increased drainage or anything like that. The septum sits midline. It's not deviated or no abnormalities with that. So that would be a normal test for the nose. Okay. So next we're going to go ahead and move to the mouth and the pharynx. So for the mouth, I'm going to do a general inspection on the outside and make sure that there's no abnormality, no lesions, no cracks or dry lips or anything like that from what I'm visually inspecting. So we're going to have her open her mouth. Okay, we're going to be noticing if there's any foul odor or anything coming from the mouth, which I don't smell any. I'm going to go ahead and look at the hard palate, the soft palate, look at the buccal mucosa, look at the teeth for any caries or cavities, anything like that. Looking underneath the tongue, especially there can be cancer hidden underneath there, which is a spot where a lot of cancers will hide. Go ahead and stick out your tongue. Okay, tongue is symmetrical, not noticing any thrush or any lesions or anything on the tongue. We're going to look at the anterior, posterior pillars, the uvula, and the tongue out, and the tonsils. Tonsils don't look swollen, inflamed, no and normal lesions or anything on the tonsils. So we're going to go ahead and test her gag reflex. So first we're going to have you say ah. Stick out your tongue. Say ah. Stick out your tongue. Ah. Okay. So whenever she does that, that's testing cranial nerve number 10, the vagus nerve. The uvula lifts, which is a normal response for the vagus nerve. So now we're going to test her gag reflex, and the gag reflex is cranial nerve number 9, the glossopharyngeal. So she should have a positive gag reflex. Some tongue out. Okay. Got a little jump there. So that's a positive gag reflex there. So we're good with that. Okay. So next we're going to go ahead and look at her neck. Done with the mouth, eyes, make sure we don't miss anything. Now we're going to go ahead and look at the neck. First thing I'm going to do is inspect just a general view of the, make sure there's no JVD, make sure that there's no abnormalities around the carotid, make sure the trachea is not shifted, it's midline, no signs of any swelling around the thyroid or any increased thyroid. The neck is symmetrical on each side, no abnormalities there. So we're going to go ahead and press, we're going to go ahead and test for cranial nerve number 11, which is the accessory nerve, by having her move her neck side to side in some different ranges of motion. So push your head against me. Good. Back the other way. Good. Put your head down to your chin and back and side to side. Okay. Any pain or any abnormalities? Okay. So that's testing cranial nerve number 11. So now we'll go ahead and we're going to palpate the carotids one at a time. That's your blood supply to your brain, so you don't want to cut your blood supply off. So carotids, there's no swelling. I don't feel any bruits. That can be a sign of stenosis. So we'll go ahead and palpate on each side, one at a time, again. We're going to go ahead and make sure that the trachea is sitting midline, which it is. We're going to go ahead and assess the thyroid. Increased thyroid, it kind of feels like a little butterfly-shaped gland. If it's increased, you can feel like borders. You want to make sure there's no nodes swelling or anything on the thyroid, and I didn't feel any, notice anything. No tenderness whenever I assess here. Any tenderness? Okay. So next we're going to go ahead and do the lymph nodes. And for the purpose of this, so I don't forget, I'm going to assess her lymph nodes at the top, and I'm going to go ahead and assess the arms, and the axillary and the infraclavicular axillary. I think that's how I pronounce it. Just so I don't forget any of the lymph nodes later on. So first we're going to, okay, down there. First we're going to start off with the preauricle, posterior auricle, the occipital, the tonsillar, the submandibular, the submental, the superficial clavicular chain, posterior cervical, back, the deep cervical, deep cervical, and the supraclavicular. Now the supraclavicular is, all of them are obviously important to assess, but the supraclavicular right over the clavicle, you should never feel those. That can be indicative of malignancy if you do feel those. So you want to be very mindful for any lymph nodes that are swollen, but especially for those, or any tenderness noted. So, and she didn't have any tenderness noted for those. So we're going to go ahead and listen to the thyroid and the carotid. You should not hear anything over the thyroid. The carotid, you should just hear the free blood flowing through it. Can be suggestive of stenosis, carotid stenosis. So you want to investigate that. Okay. Again, carotids are one at a time. So we have the left. I'll go ahead and listen to the left thyroid, which I hear nothing. Okay. We have the right. Don't press too hard either. And then we have the right thyroid. Don't hear anything there. So there was no abnormalities as far as the neck goes. Okay. So next we're going to go ahead and test the upper extremities. So first I want you to shrug against my shoulder, shrug against my hand, okay? Okay, I want you to lift your arms in front of you, like this, and then push against me, okay? Pull back, okay? So she has good strength, equal strength. I want you to squeeze. Okay, she has good strength. I'm going to do an overall inspection of her arms, no edema, no swelling, no bruising, ecchymotic areas. I'm going to assess her brachial pulse, which is a 2, which is normal. We're also going to assess the radial, which is normal. We'll go ahead and take a general look at her nails. There's no clubbing, no signs of cyanosis. Her capillary refill is less than 3 seconds, so she has good blood flow to her arms and everything. We're going to go ahead and take a general look at her back just to see if we notice any abnormalities on the back. So go ahead and turn around for me. Try to be in the camera here as much as I can. So we're just doing an overall look at her back. We're going to look at the cervical spine where we're back here, make sure that it's aligned, there's no abnormalities. No abnormalities with the spine, no scoliosis, kyphosis, anything like that. Shifting of the spine or anything. Any tenderness noted? No, nothing. So there's no tenderness. While I'm here, I'm going to go ahead and do her costal vertebral angle assessment. This assess for pyelonephritis. Once you do this test, if there's any signs of tenderness whenever we do this, then that can be a sign of pyelonephritis. So I'm just going to place my hand over the kidney. Hopefully you can see that. I'm just going to hit it once. Any pain with that? Okay. So again, you would put your hand over the kidney. Any pain with that? Okay. So that would be a negative finding for that test. Okay. You can sit back for me. Okay. So next we're going to go to the lungs. As I'm looking at her, her respirations are equal. She's unlabored, no shortness of breath noted. Respirations are, as again said, equal. Her chest excursion appears to be equal to me. I'm not noticing any abnormalities with the symmetry of her chest rising and falling when she takes a deep breath. I'm not hearing any audible like wheezing or bronchi or anything like that. Any abnormal signs with that, I should say. So first we're going to do is tactile fremitus. Basically, I want you to say 99. 99. 99. 99. Okay. We're going to do the lateral. 99. Okay. Okay. That is a normal vibration that you should hear whenever we breathe. Increased consolidation would make an abnormal tactile fremitus if it's more pertinent whenever you feel that tactile fremitus. So. Okay, say 99. 99. 99. 99. 99. 99. Okay. So while I'm here, I'm going to go ahead and make sure we can see it. I'm going to go ahead and do her diaphragmatic excursion from the back. I'm going to place my hands here. I want you to take a deep breath in. Okay, and back. Okay. So whenever she takes a deep breath, my fingers separate, which is a normal diaphragmatic excursion. There's no, they're both symmetrical whenever she does that. Okay, we're going to go ahead and do that for the front. Take a breath in. Okay, so they both expand equally, their symmetry. So next we're going to go ahead and listen to the lungs. Deep breath in out. Okay, we'll listen to the lateral. Okay, lateral. Okay. Whoops. Of course, we're going to do the same thing to the back, so we'll go ahead and have you turn around. Listen to the lungs. Okay. Take breath in out. Okay, good. Now, while I'm here, I'm going to go ahead and do the 3 tests for bronchoscopy, egophony, and the whisper ventriloquy. For the first 2 tests, they should be muffled sounds. And for the egophony, I'm going to have her say E. It should sound like E. If it sounds like A, that means there's increased consolidation, which is abnormal finding. Okay, so have you turn back around. Say 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, so for bronchophony, that sound is still muffled. Okay, say E. 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 Good. So the E sounds like an E, not an A. Okay. And then I want you to whisper hello. Okay. And that word was muffled as well, which is normal for that. Okay. You can turn back. Okay. So next we're going to go ahead and move on to the heart. Okay, so we already listened to the respirations. We already did a general inspection of her, looked at her excursion, her respiration. So now we can go ahead and listen to her heart sounds and do an inspection of that. So first we can start with the palpation. I'm going to go ahead and listen. We're going to put our hand over kind of by this intercostal, right underneath the, kind of like underneath the rib cage on the left side. We're going to feel for any pericardial thrills, which would be an abnormal sign. So we're going to listen for that. Also, we can feel for any heaves at the apical impulse, which is at the fifth intercostal left clavicular. That's also your PMI, point of maximum impulse. And I don't feel any of that, so that is a normal finding. We're going to go ahead and percuss in the intervertebral spaces. And I hear resonance, so that's a normal finding as well. Okay, so that's a normal finding. Now we're going to go ahead and listen to her heart sounds. We have the aortic, the pulmonic, Erb's point, tricuspid, mitral, and we have the apical, the PMI. I didn't hear any murmurs. All of the sounds are S1, S2. I didn't hear any extra, S3, S4s, which could be indicative of mitral stenosis, aortic regurgitation, all the different heart abnormalities that you can have. So hers was a normal assessment for that. So now we're going to go ahead and move to the abdomen. So we're going to have you lay down here, please. Okay. We'll have you lift this up. So I'm going to do an overall inspection of the abdomen just by looking. I'm going to see if there's any ascites, any edema, any swelling on the abdomen. I don't notice anything. Any hernias can also protrude or anything like that. I'm not noticing anything. Move that a little bit further, closer, so you can just see that. Looks a little better. So I'm not noticing any abnormalities with that. So first with the abdomen, we're going to start off with auscultating. You don't want to palpate first, because then you're going to wake up the bowel sounds and then you're not going to hear what you need to hear. So you're going to go ahead and listen first. So all 4 quadrants. Okay. They recommend that you can do this up to 5 minutes whenever you're listening to the quadrants, but her bowel sounds are positive bowel sounds. So next we're going to go ahead and listen. I'm going to set in the center for the aortic. Listen for renal, both sides. Iliac, sorry. Then we're going to do femoral. Okay. So now we've listened to the abdomen. Now we can go ahead and percuss the abdomen. Whenever you percuss, it should have a tympany, okay, which is over the abdomen, kind of like a drum. Whenever you percuss the abdomen. Okay, we're going to go ahead and percuss for the liver border and the spleen. You're going to start from the top. You're going to percuss until you feel a dullness. Once you feel the dullness, you're going to mark that spot. You're going to percuss up. You're going to feel the dullness at the bottom, hear the dullness at the bottom, and then you're going to go ahead and mark that. That's going to be the liver borders, the liver. So again, you're going to percuss at the top on the left side. You hear the dullness, that's going to be the spleen. Again, percuss up. And then the bottom part, and you're going to hear the dullness, and that's going to be the spleen as well. So then you know your spleen like that. Next, you're going to go ahead and palpate. First, you're going to start with a light palpation. Then you're going to go ahead and do a deep palpation. On the deep palpation is where you're going to feel for the liver and actually feel for the spleen. And you can, at that time, feel for the aorta during that time. Okay, so for light palpation, you're just going to lightly feel for any masses, any unusual areas. note any tenderness that the patient may have. On deep palpation, you're going to do a little bit deeper palpation on the abdomen. Make sure you can feel for any masses or lesions that may be in there. You're also going to go ahead and palpate the liver borders, which is going to be right underneath the right rib area. You can feel the border of the liver there. Note any tenderness or anything like that. Again, you can do the same on the left for the spleen. You want to note if there's any tenderness noted on the palpation of the spleen on the other side. She's a thin patient, so it's for her it's no problem for me to actually assess the aorta. I can feel the aortic pulse underneath my hand, so depending on how big the patient is or the habitus, you may be able to feel it, you may not, but I can definitely feel hers underneath my skin, the aortic. And her muscles are, her abdominal muscles are strong, so no issues with that. Okay, so next, we're just going to do a general look at her, hold that down. Going to do a general look at her legs. Hair is evenly distributed, not noticing any lesions or abnormalities on her legs, no increased scarring or anything like that. Her temperature is warm. Her no signs of PVD with like increased dark skin, no cellulitis or anything like that. Her CAP refill, it's -3 as well. So we'll go ahead and feel her pulses at the popliteals. I'll do them while she's here so you can see. And we have the dorsalis. You can do it when she's sitting up, but I want you to be able to see. We do it on post. And then the posterior tibial is on the inside of her ankles. So you would do it on both. Like I said, we can do it when she sits up, but you won't be able to see. And they're +2s, which is a normal finding for the pulses. So we're going to go ahead and do a range of motion. Just make sure we can support behind her knee, bend the leg back. Just make sure she's able and has good range of motion with her legs. So for the tendon reflex, we will have her sit up so you can see that better. So go ahead and swing your legs around and sit up for me. Okay. For the tendon reflex, I'll kind of put this down just a little so you can see a little bit better. Oh, I need you now. So where's my little camera go? Here it is. Okay. So for the tendon reflex, just going to, when we're doing this, we're going to do the, just going to have our hands supported here. We're going to go ahead and get below the knee. Okay, so that's a positive deep tendon reflex. Here we go again. Good. So we had positive reflex with that. For the Achilles, basically what you would do is support the patient. I'm going to see if we can get it up, but you really didn't do it this time, just showing you. You would put your hand underneath the ball of the foot. You're going to support it like that. You're going to hit in the back of the foot at the Achilles tendon. Okay. So positive response would be her foot pushing down on my hand. She did. Do it on this one. Good. So that's a positive response on that. So just doing a general, making sure that I didn't forget anything for this. Eyes, ears, nose, face, whisper gag, So I think I'm done. I don't think I forgot anything, but I'll look it over and thank you. This concludes my video.